We're here with Dr. Scott Haskins talking about shoulder pain. Dr. Haskins, what are some common reasons for shoulder pain?
There's definitely lots of problems that you can have with your shoulder that would cause pain. The most common are things like rotator cuff injuries, labrum injuries, dislocations, and you can even have long-term arthritis.
How do you know when it's time to call the doctor to get your shoulder evaluated?
You can definitely have lots of aches and pains around the shoulder, but if it's something that persists for many weeks and it's not responding to simple treatment like anti-inflammatory medication or ice or plain rest, then it's probably time to call the doctor.
Why is it so important to make that call and not put it off?
There are some shoulder injuries that you don't want to put off too long. Continuing to use the shoulder may cause more damage or cause it to be more difficult to fix if needed.
And what should a patient expect when they come in for that first appointment?
The first thing we'll do is sit down and talk about what's causing the difficulty with the shoulder, talk about what kind of injuries you've had, where the pain is located, and then we'll take a look. There's lots of different tests that we can do on the shoulder, testing strength, motion, instability. So we'll start with the physical exam.
And what would you say Prevea's philosophy is when it comes to treating shoulder pain?
I think that, first of all, we figure out what is going on, and then we discuss with the patient the options for treatment and find the best way to get them back to what they like to do.
What are some of the most common treatment options for shoulder pain?
We certainly have a lot of options. One of the more common is physical therapy, which can help with range of motion, strength, mechanics of the shoulder. But there are definitely injuries that do require surgery. Some surgeries may include arthroscopic surgery for, say, for instance, a rotator cuff repair or a labral repair. We can even do surgeries such as replacements for osteoarthritis.
In addition to therapy and surgery, are there any other options for treatment?
There are. One thing we use often is cortisone injections. That can provide decrease in pain and inflammation that can either help on its own or in addition to those other treatments.
And what does recovery look like for procedures that you've just mentioned?
It can vary depending on the injury and the surgery that's needed. Oftentimes for the shoulder, you would be in a sling for somewhere between 4 to 6 weeks, and therapy would be guiding you through the process to return to your normal range of motion and strength. It can certainly take 6 months or more to get fully recovered, but it's a gradual process.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.